Hi, my name is Ashley Stavro. I'm a physiotherapist at ABC Health Clinic, and we're here today to talk about two machines that we have. There's the Shockwave machine and the laser therapy machine. I'm here with chiropractor Dr. Danikel Jihu and podiatrist Dr. Ron Bustillo. And hopefully by the end of the video, we're going to answer some of your questions about these machines, and then you'll know better how they can help you with your body aches and pains. So my first question is, what do these machines look like and what do they do? So maybe we can start with Ron, you can answer about the Shockwave machine.
Sure. Shockwave looks essentially like a mini gun. It sends like an acoustic wave. The principle is that it sends a little bit of energy in the area that's kind of pathological, and hopefully with a number of treatments it's going to help relieve the pain in the area.
And the laser that we have is basically a medical grade laser. So we use lasers for a lot of different stuff, but in our field, we really use that machine to target a specific tissue. It's a pretty tiny machine. It's really powerful though, and it's a grade 4 laser. So it's like the newest type of laser that we have in the medical field. Before, like our clinics, or in the past, we had like the grade 2, grade 3 types of machine. But the one that we have here at the clinic is the grade 4, which basically is like just big like that. And it looks kind of similar to the Shockwave machine basically, and it's like just a big flashlight.
Yeah.
So and it creates like a red light. So the other term for that is like red light therapy. That's another like branch of that therapeutic field. But basically, it's like a big flashlight.
Yeah. And what's nice is all three of us are able to use these machines.
For sure.
So physio, chiro, and
on the patients, for sure.
So my follow-up question about that is, what do these machines do more on a physiological basis? Shockwave?
Yeah, so Shockwave, it's kind of twofold. For sure, it does relieve a little bit of pain. There's a little bit of numbness in the area that goes on. It's transient, so it doesn't last very long. But patients do often leave the clinic feeling much better than when they came in. So that's definitely a benefit. It also increases blood flow, which is important for healing, right? We all know we need proteins to kind of help build structures that were damaged recently. And it also reduces inflammation. So initially, yeah, there will be a little bit of tenderness in the area, but in the long term, what it does is it reduces like pro-inflammatory factors that are in the area. So that's definitely an anti-inflammatory effect.
So in general, analgesic effects and promoting healing.
That's right.
What about laser?
So the laser works a little bit differently actually. It's basically just light, so it's red light therapy, and it has a really specific wavelength, so it's going to target some specific cells in your tissues and in your muscles, your tendons, your ligaments. And basically what it does is that it boosts the healing aspect of those cells. So it's going to target the mitochondria, which is like the aspect that heals and deals about with like the energy of your cells. And basically that wavelength is going to just speed up the recovery and the metabolism of these mitochondria. So your cells, they use the oxygen more efficiently. And what it does is it's just going to reduce. So it's not magical, right? It doesn't work like magic, but basically it's going to take a little bit less time for the tissue to heal. It's going to reduce the inflammation as well, reduce the pain level, because it boosts the metabolism of those cells that are injured. So
boosting the healing process to speed it along, push it into the right direction.
Basically, that's what it does, and it's called biophosphomodulation. So that's the term, which is really complicated, but basically just boosts the metabolism of those cells.
My next question is, are there any negative side effects from these machines?
Yeah, so Shockwave has a bit of a bad rap. Yeah, it definitely hurts in certain areas. So depending on what we're treating, how acute the problem is, especially areas where there's not a lot of soft tissue, like behind the heel, it can be a little bit tender at first, but like I mentioned earlier, there is like a numbing effect. So by the time patients leave, they don't really experience any pain. In other areas where there's a little bit more tissues, there might be a little bit of swelling in the area, and there's a little bit of soreness. It can last maybe, I would say, 3 or 4 days, but it usually subsides. So there's definitely like an increase in tenderness in the area, and then it kind of subsides. And that's kind of what we expect.
With the Shockwave?
Yeah, exactly.
Okay. What about laser?
Well, on the other hand, the laser is a lot more gentle. Basically, you won't feel much. You might feel a little bit of heat, which usually patients are going to say it feels good because it warms up the area. Basically, we just shoot a lot of energy in the tissue, so it feels either like you don't feel anything or you feel a little bit of heat with that. So it's a lot more fun to receive that kind of treatment, but it's for different conditions, obviously. So
And no negative side effects after the treatment.
After the treatments, no, you don't have to do anything specific afterwards, so you can go back to your daily activities.
So we talked about some side effects afterwards. I want to know, is there anything else we have to pay attention to or any recommendations after the treatment?
Yeah, like Dan mentioned, actually, for Shockwave seen through the laser, there's no like restrictions necessarily in terms of like physical activity. Oftentimes, I do the treatment, and then patients go back to either working out or back to work, whether it's physical or not. So that's a benefit definitely of the Shockwave. In terms of the post-treatment recommendations, Tylenol sometimes would definitely be beneficial. We want to restrict anything that's anti-inflammatory. So the whole process of Shockwave is to necessarily increase a little bit of inflammation temporarily. So taking anti-inflammatories or applying ice would be not recommended for the first couple of days. After the 3 or 4 day period, you can take anything you need.
Well, for the laser, basically, there's not a lot of restrictions afterwards, like I already mentioned. I just want to mention that, like, just the laser alone is usually not that effective. You need to like have a proper game plan with your therapist. That could be podiatrist, chiro, physio. So yeah, that's the thing. You're probably gonna need to do some exercises, to do some strengthening of some sort, maybe some other types of manual therapy. And you add the laser on top of that, maybe just to accelerate and to speed up the recovery process. So that's what I would say, but there's nothing else that you need to pay attention to. So.
Maybe I'll start with Dan on this one. How often would you want to do the laser treatment on a patient?
So like always, depends on the patient, depends on the condition, obviously. Usually at first we try to do more laser treatments like in a short period of time, just because we want to really like shock the tissue, right, and make sure that recovery process is exactly to boost it. So usually we're going to start with like the typical protocol is going to be 3 times in a row, and then it's twice a week for a number of weeks. It usually varies between 2 to 4 weeks for the protocol, and once again depends on when the injury happened and what was the tissue that we treat. So.
What about Shockwave?
It really depends on the pathology. I mean, in general, I tend to use one treatment a week. It can go up to 2, maybe even 3 treatments per week, according to the literature. The number of treatments, it really depends. Depends on the pathology, like you mentioned. In general, I would say 4 to 6 is enough for most pathologies, but I have had to go up to like 10, as long as there's as long as there's progressive improvement, and obviously some lingering symptoms. But I mean, that's really a rarity. I think it's usually 3 or 4.
Okay. So my next question, I'll start with Dan again for this one. For laser, what type of patients or cases would you want to use the laser for?
So laser can be used in a number of different conditions. Basically, you could use it on almost every condition because it reduces the pain level, but usually we're going to try to focus on the acute injury. So something that happened recently, so last couple of days or last couple of weeks, or something that just happened. There's a lot of swelling, there's a lot of inflammation, a lot of pain. So we're going to use that therapy usually in the first couple of days. The typical case for that would be like a soccer player that comes in with like an ankle sprain. Usually in the past there wasn't much we could do in the first couple of weeks, right? Basically you wait and you just give a couple of recommendations. But now we have that tool, so we can do stuff on the patients that actually speeds up the recovery process. So that's very fun for those conditions. And then when the tissue is healed, we can go back to the exercises, the strengthening, and everything that we would normally do, but probably a little bit quicker than we did in the past. So.
Yeah. And what about Shockwave? What kind of cases would you use it for?
Yeah, I tend to use it more for like chronic issues. But in certain instances, when there's like a chronic issue that's kind of like currently inflamed, so like an acute issue on top of a chronic issue, I would combine the two. So to get the benefit of both, right? So we're treating not only the acute phase, but also the chronic problem that's kind of underlying the whole aspect of the treatment plan.
Have you also combined them, like laser and Shockwave?
Yeah, so that's something that's really, really effective usually when it's done on the right condition. Like we said, the Shockwave is going to bring some blood flow in the area, and then you have the laser that just takes care of like healing those cells and make sure that blood flow is used efficiently by the cells and the mitochondria. So yeah.
Nice. And what type of conditions would you use it for?
I think I get good results with like Achilles tendonitis. I'm sure you've used it too.
For sure.
Shockwave and laser combined as well. Neuromas as well. It's a very good alternative to classically cortisone injections, which I tend to use a little less now. since I've started using the Shockwave. It's the benefit again is that it's very little pain.
Non-invasive.
And non-invasive, exactly. And the results are fairly quick, so there's no downtime, right? Whereas with cortisone, it's definitely effective, and I have to use it sometimes, but there is a little bit of convalescence after the injection, so that's a definite benefit of the Shockwave.
Cool.
Sounds great. Well, laser is usually used on sprains, strains, contusions, something that's maybe more like a trickier aspect, but even on fractures. So when you go to the hospital or to go to see a medical doctor, and they decide not to put you in a cast for a lot of different reasons because there's no movement of the fracture or anything. Sometimes we don't have much to do, but if you use laser on top of that, it's just going to take care of the swelling and the pain level. So that can be something interesting too. Like I said, it's a little bit trickier because you need to have the proper evaluation, the x-rays, and the right images taken before obviously making that decision. So, but basically you can use that on every condition that's painful and every condition that needs a certain amount of time before it heals, just to speed up that recovery process.
My last question, have you ever used the machines on yourself?
Oh yeah, definitely.
Ron?
Definitely. Yeah, I have lower back pain. I've used laser for sure, helps a lot.
Nice.
Achilles tendonitis, not fun. There's not a lot of meat behind it. Yeah, exactly. Yeah.
Dan, have you used it?
I mean, obviously, it's always important to use it and to try it before doing on a patient. So I remember in school, university, we tried the Shockwave on ourselves before. So I've never done it on myself, but I had some colleagues do it to treat a number of conditions.
Yeah.
So yeah.
I've had the Shockwave done on my arm before and the laser.
Okay.
Yeah.
And which one did you prefer?
I don't mind either. They're both, obviously the Shockwave is a little bit more sensitive in the moment, and the laser feels nicer, but they both have nice effects after.
That's awesome.
Thank you so much.